Hi, Oluchi here. Last time I talked about shift dynamics. Today I'm going to talk about the different facilities where a nurse can work. Back home, we are familiar with hospitals. It's mostly just hospitals, whether a state hospital or local government hospital or federal hospital, teaching hospital is always a hospital. Now, of course, there is the private hospitals. Here, the difference is that the services in the hospitals, as we know it, the traditional hospitals, are broken down into segments and they can stand alone like units. Like you can walk into a place that is just emergency services that are offered there. So you see, one segment of what happens in our own traditional hospital is removed and is a standalone unit. So that's one difference. That's one big difference with their own. Then another difference is that the majority of healthcare services are offered by companies or private individuals or groups. So unlike our own, where almost everything health is the government that takes care of it. Quite okay, we have private hospitals, but they are just a handful compared to the government hospital. So here is like opposite. The government hospitals are far less in number than the private groups and privately owned companies or facilities. So they also have traditional hospitals here. They do have traditional hospitals here, but then they have specialties. Also, they have what they call long-term acute care facilities or long-term acute care hospitals and short-term acute care hospitals. So unlike in our own setting where you can find somebody staying in the hospital for a very long time, some people stay even years in the hospital, especially patients that need wound care and all those kind of long treatment regimens. They stay in the hospital, but in their own case here, what they do is that there are special units that take care of those patients that need to stay for a longer period of time. Hence the name long-term acute care hospitals. In long-term acute care hospitals, people that need to stay in the hospital for 25 days or more do stay there. They may have a combination of therapies, maybe occupational therapy, physical therapy, speech therapy, IV antibiotics, rehabilitation, respiratory therapy, wound care. So all those people who need those kind of treatment that may take for a longer period, they are sent there. Short-term acute care facilities is just a similar idea, but they stay for shorter periods of time. Then they have, like I said, there are emergencies that stand alone. There are emergencies that stand on their own. And then they have what we call urgent care. So urgent care is an in-between, It's not an emergency per se, but it's not something you should just sit on and leave it. It's not something you should wait till you book a clinic date or go to the hospital or go to a center where they treat that. It's something that is not an emergency, but it cannot wait. So they handle that in urgent care. They call it urgent care. Maybe somebody has stomach pain or some kind of chest pain or whatever that may not be graded an emergency. So those people are taken care of there. That's urgent care. Then they have hospice. Hospice is a place where they take care of dying people. Then they have nursing homes where they keep old people or people who need care for a very long period of time, maybe throughout their lives. Then there is home health. In home health, the health providers go, especially nurses, they go to the homes of the patients and carry out cares. And it could also be just caregivers or certified nurse assistants. People with some kind of training with sick people, they will go to their house and then take care of them, whatever they need. That's home health. Then they have clinics. Clinics take care of, clinics is an in-between between emergency, urgent care is somewhere in between clinics and emergencies. So for clinics, is maybe follow up, one issue or the other that is not an emergency, you go to the clinic, you book a date and they see you there. So primary care in the clinic and specialist care, you can also go to specialist clinics such as dental clinics, cancer clinics, and then they have centers, dialysis centers, bed centers, surgical centers, orthopedic centers, infusion centers where they just give infusions and the people will leave. Then addiction centers. So there is a lot of it. There are so many places you can choose to work. So I'm going to stop here. Thanks for listening. If you have any questions or any comments, please drop the comments, drop the questions. Let's keep it interesting. Make sure to like, share, subscribe, and follow for more. Thank you.